All right, I'm back with another one, medical billing and coding students, current medical biller and coders, collectors. Yes, healthcare industry. We're in the office, Cubicle Nation. So let's get started. Today, we're going to talk about the difference between medical billers and medical coders / collectors, okay? There's a big difference. And if you're starting out in this career or if you're already in this career, this video is great for you. If you want to be a medical biller and coder, you might want to have a certain personality. There are different job duties that you're going to do there that has to fit that type of personality. And they do get paid a lot. Medical coders usually make more than medical billers starting out. Because if you're a great medical biller and collector, you can climb that ladder pretty quick, showing that dollar amount you can collect, proving yourself. You can catch up with that medical coder. So let's take a look at the differences. Medical billing is extensive. In medical billing office, you have the ladies at the front that might be getting authorization, talking to the patient about their benefits, to see how much their copay is and their deductible at the front end. So when you go to the back office, the medical billing department starts to extend. I mean, big time. You've got payment posters who post payments from patients. They post payments from the insurance companies. You've got appealers or just regular billers or accounts receivable, whatever they call it. But you've got the people that actually submit the claim to the insurance company after the patient is seen by the doctor. So once the patient is seen, the medical biller may submit the medical claim to the insurance company. Then once it comes back, they have to handle the claim. If it has not paid, it could deny because patient information is not correct, it needs medical records, or it needs to be recoded. But we're going to talk about the coder's responsibility after this. As a medical biller, you're wearing many hats. You're coding what the doctor does versus the diagnosis that the patient has, and then you're the one to send that same bill either in the mail or electronically to the insurance company. Then once it gets back, either you'll get payment, which is what we want. We want a payment. We want a clean claim every time. But if not, you have to send the medical records. You have to handle the denial, whatever reason it is. You may have to do a different code, send it in with medical records. You may have to correct some patient information, but you're also wearing that hat. And then when the insurance company pays, you're the one posting the payment from the insurance company. You're the one calling the patient, calling the insurance company, asking them why this claim has not paid. So you're wearing all of the hats, and that's a very big job. So when you're applying for a small office, keep that in mind that you'll be wearing many hats as a coder and a biller and a payment poster and a front desk. If you're in the billing office, you are checking emails, you're answering phone calls, you're faxing information, you're appealing claims, you're communicating with the front desk about patient information, insurance information, arguing on that phone, mailing out appeals, communicating with coders if you're not coding yourself. You may be communicating one-on-one with the doctor if you're in a small office. As a coder, coders are very important. Coders don't have to be involved with interacting with patients. The coder interacts with the doctor. So if you're coding, you're interacting with medical records, coding books, and materials. You need to have strong anatomy and physiology, okay? You need to know the laws of medical billing and coding as a coder to protect the doctor. You have to make sure clean claims are coming out. Now, coders, they do make a lot because they're the ones that work with the doctor to put the correct code and the correct diagnose in the system. And then they track trends like denial trends and new trends with the codes. Maybe there's a new code that is coming for a procedure or a new procedure, or maybe an old code is being deleted. So coders are super, super important, and they're often paid more because they're the ones doing extensive anatomy and physiology, reading through the medical note to determine what the doctor did and what code needs to be put with that. Hello. Let me talk to you about this. There is a saying, I think this is in healthcare altogether. If it was not documented, it did not happen. You have to document everything. And it's important for the coders to document very carefully, as well as the physician to document very carefully, and the biller to document the whole process all the way until the claim is paid. Because sometimes insurance companies request medical records and they request prescriptions and other information, so we want to make sure we're documenting right. Understand, if you want to be a medical biller, you have to analyze. You have to look at a lot of information, read through a lot of information. You're going to have to do a lot of follow-up. You have to be really good with customer service. You'll be talking to patients and you'll be talking to insurance companies. You have a lot of information in front of you and you're going to have to talk and understand what's going on. Meanwhile, you could be getting emails, you could be sending out claims, talking to payment posters if you're not posting yourself, and communicating with the coding department. So you're wearing many hats as a medical biller. I think this is one of the most important positions in healthcare. If you don't do your job right, the provider won't get paid, and the provider needs to be able to pay the entire staff. So as a medical biller, your position is super, super important. As a medical biller and coder, you will be investigating. As a coder, you'll be looking at the codes. In a coding book, you'll be looking at anatomy and physiology books. You'll be talking to the doctor. You'll be trying to figure out what's the right code, what's the right diagnosis to get this claim paid. As a biller, you'll be investigating the claim at the back end. So it is super, super important to be able to understand denials and research denial trends and know what's going on in your specialty. It's a constant learning environment. This is a bonus. I'm gonna make videos about collections and tracking trends. Whether you're a biller or a coder, it is very important to track your trends. What do I mean by that? The best place to track your trends is in an Excel spreadsheet, because if you can transfer your report into an Excel spreadsheet, you can filter out information. So you can filter it by patient name, date of birth, insurance company, procedure code. By filtering this information out, you can track your denials and see what's going on. Sometimes there's a particular code. Sometimes there's a particular diagnosis to why a claim is denied. Companies filtering them by insurance carriers will help you to say, this insurance company is denying this, but this insurance company isn't. So tracking trends is super important, whether you're a coder or a biller. If they're paying, how much they're paying, and what insurance company is paying more, how often the insurance company is paying these. So tracking your trends is super, super, super good. It makes your job easier. You're not looking at one denial at a time. Another bonus, I'll do a more extensive video about this later. Documentation. You should be putting as much information as possible in your notes. And as a biller, you want to make sure you're putting detailed information. If you talk to the patient, you want to make sure that the date that you talk to the patient is in the system. If you talk to the patient themselves, or if you talk to the patient's spouse, ask them detailed questions. If you're making payment arrangements, when can they make the next payment? Whatever the issue is, you want to be as detailed as possible. Now, when you're noting information coming from insurance companies, you always want to put the date, the insurance company, the person you spoke with, their title, what they said about the procedure code, and the denial. So you need to be very, very, very detailed about this. You need to have the date of service. When did the patient see the doctor? What claim are you talking about? What procedure was done? These things help the person that's coming after you. Then you talk about how it was fixed. Did they send the claim back? Did they tell you to recode it? What did they give you as a resolution? Was there a resolution? Is there a follow-up? If they send the claim back, how long will it be before you receive response? These things are important, and it helps the people that are coming behind you. A good follow-up tool is an online date calculator. It will tell you 30 days from today. So if you're following up on a claim or an issue or even an email to someone, that date calculator will give you that date in the future to follow up. You want to follow up with everyone. It shows that you're on your game, you're doing what you have to do, and it prevents you having to backtrack. Now, some systems already have that built in. You can plug in a date, follow up on this date, and it'll remind you. And then you'll have your note in there, a detailed note to follow up so you can get that money really, really quick. And also in your email, you can put a reminder in your calendar to contact that patient. You want to stay on them to strengthen your patient collections, but we'll make a video about that later, about how to get that patient money, get the patient collections, and a good script to say. All right, you guys, so in short, medical billers, coders, collectors, they are all important because they all work together. And if you're one person, you're working it all. You're working it all out. But you have to have your basic computer skills. You have to know how to operate systems as far as like faxes, printers. You'll be printing off medical records a lot. You'll be documenting a lot of information into the computer. You'll be working with patients and doctors and coworkers. So you have to have real good interpersonal skills and be able to work good with people. You're gonna have to multitask. You're gonna be typing, emailing. Wear a huge hat, whether you're a biller or coder, because the doctor, the hospital, the team, they depend on you so everyone can get paid. And we want maximum reimbursement. Yes. All right. Thank you. Like, subscribe, share, hit that notification bell for new videos. Providers, medical biller, and coders, if you need help, contact me for Zoom meetings.